Good morning, I'm Stacie Grossfeld. I'm an orthopedic surgeon from Louisville, Kentucky. This morning I'm going to talk a little bit about tennis elbow. The official name for tennis elbow medically is lateral epicondylitis, and your lateral epicondyle lives here on your elbow, and you have two major tendons that attach to your lateral epicondyle, go down your forearm, and then attach at your wrist. Those two tendons can get inflamed, and they are called your ECRL and ECRB, which stands for extensor carpi radialis brevis and extensor carpi radialis longus. And they attach here, and these are the two tendons that get inflamed. So when you have tennis elbow or lateral epicondylitis, your pain will be located over the lateral aspect of your elbow joint. It is typically an overuse injury. It's not caused from one traumatic event. It tends to occur from repetitive use, whether it's your job or what you like to do recreationally, but it occurs from repetitive use. The treatment for tennis elbow starts with a tennis elbow band, and it is a band that wraps around your arm. We place it 2 finger breadths below your lateral epicondyle, should be the top portion of the band. And it doesn't have to be a fancy band. It can just be any band that you purchase at your pharmacy or you get from your orthopedic surgeon. And the purpose of the band is to reduce the force or tension where these two tendons attach at the bone. So if you put the band on, it reduces that force, which will allow those tendons to heal. We recommend you wear the band 24/7, except for personal care, for 6 weeks. This diagnosis does not go away quickly. The second treatment we recommend is exercises, and I have posted on my YouTube channel a video on how to do different stretches and deep friction massage to help reduce the inflammation of the tennis elbow band. So if you just Google YouTube Grossfeld tennis elbow exercises, that video will pop up. Other treatment options range from an anti-inflammatory medication that can help to reduce the inflammation at that tendon area. The problem with an anti-inflammatory medication or any other medicine you take by mouth is that particular area of your tendon does not have a very good blood supply. So it is your blood that brings in the anti-inflammatory medication. So if you don't have a good blood supply there, you're just not going to get much medication delivered to that area. Other options is a cortisone injection. I'm not a big fan of a cortisone injection for that area because it can cause fat atrophy, which means you'll lose fat in that region, which will make your bone look like it's sticking out funny. It can also cause vitiligo, which will cause your skin to turn as white as snow, about the size of a quarter. It's cosmetic, but it'll last for about a year if it does happen. And more importantly, it gives you almost immediate relief. And then people start to get back to their activities very quickly, and then they have a recurrence of their symptoms. So cortisone is definitely not my first treatment option. If you're going to get an injection, I would recommend a Prp injection, which is platelet-rich plasma, where we draw some blood from your arm, we separate out the platelets from the rest of the blood cells, we inject the platelets into that area, which are full of growth factors, which will help heal, which will actually help heal the inflamed tendon. And then the third option is stem cell recruitment therapy, where we inject stem cells, which can help repair the damaged tendon. And that also has about 280 growth factors, which also help to repair the injured tendon. Thank you.